When you're a hospice nurse, you know hospice runs 24/7 and your day can take you to a lot of different places. Like today, I've already conducted an in-service at one facility and just finished a nursing visit at another facility, and I've got a full day of patient visits ahead of me. With these types of on-the-go demands, it's critical that hospice professionals have tools that are built to work the way we do. That's why Hospice Tools is an awesome solution for hospice pros. It really follows my workflow and makes managing my day much simpler. When I'm on the go, I can access Hospice Tools using a mobile app that's actually built for mobile devices, which makes documenting clinical visits simple and fast. Let's log into the Hospice Tools clinical software eDocs on the mobile app. You see, as soon as I log in, I've got my dashboard, and I can do anything on the mobile app that I can do on the desktop. I've just completed my visit with my patient, Betty Roberts. So now, to document my visit, I'm going to click on View Charts. We're going to search for our patient, Betty Roberts. And in any free field, I can type or use the keyboard's talk to text, Roberts. And there she is. I just click on her chart and it takes me right in. The first screen we see is our intake screen. And this is great to double check information. And it's totally editable, even from the mobile app. You can see in the Contact tab that Betty is currently at the Acme facility. I can go into sticky notes to check out any other extra details that might be helpful. And I just scroll over and click on the eDocs tab, and I can do my charting right in the app. We'll click on New Documents, and we get a few options. I can upload a doc, or we can create any number of new docs. This was a nursing visit, so we will select Nursing Visit Note, and we will begin charting right away. And you see, we start with entering the date and time of our visit. If you've seen my video on Timekeeper Auto Build, you know this information will flow right into my timesheet and automatically match my clinical time and clinical visit for automatic billing and compliance. The date of our visit is October 1st, and we started our visit at 11:30 a.m. We were with Betty for an hour, so we'll enter that the visit went to 12:30 p.m. We can document the people who were present during the visit. In this case, the caregiver Geraldine was there as well. The primary concern during the visit was Betty's pain. We'll go ahead and enter her vital signs. And many of the fields provide different options, like this field here for how we took Betty's temperature. In this case, it was temporal. We can put in her respiratory rate for oxygenation. Betty's using oxygen and she's on 5 liters per minute. We can put in her heart rate and her pulse, her blood pressure. We can document it either laying or sitting. And you'll notice at the end of this section, we can add comments as well. The forms really cover all the information we need and still give us flexibility to individualize for each patient. And the form is broken into sections. So we automatically save at the end of each section and then move on to the next section. We'll document her mental status. And notice, up at the top of each page as part of this nursing visit note, we have a drop-down menu. That lets us know which section we're on and allows us to easily navigate between sections. The first page was the vital signs, and here we have the mental, behavioral, and speech assessment. Betty is alert, but confused and lethargic. Her behavior is cooperative, and her speech is clear. And as we finish the section, again we see that we automatically save what we've done before moving on to the next section. Now we can and do our pain, neurosensory, cardio, and nutrition assessment. Betty verbally reported that she isn't having any pain today, but she is having a little bit of trouble sleeping, so we can document that. And she doesn't have any chest pain or edema, so we can skip the cardiovascular section. However, there has been a change in her appetite, so we can scroll to the bottom and we can document the change in Betty's appetite. And we'll make a note that on Sunday, Betty ate less than half her usual intake. You can see in the documentation forms. The combination of simple but comprehensive checkboxes and free-form text fields really allows us to customize the documentation specific to our patient. Scrolling over to the next page, we have a section for GI/GU assessment. However, we're going to be running late to see our next patient, so we're not going to finish the rest of the nursing note right now. Instead, we can just go ahead and save the document. And when we close out, you can see that next to the document in the chart is a red bubble. That indicates that the doc isn't finished, so it hasn't been completed or submitted. I will show you later on how to complete that document. In the meantime, we're going to go and complete the rest of our patient visits for the day. Okay, we've seen all our patients for the day, and now we want to go ahead and complete our charting. Since we're back at the office, let's go into Hospice Tools on our desktop. When we log in, we see it takes us right to our dashboard, and you'll notice that we have an unfinished document front and center on our dashboard. This is the nursing visit note for Betty Roberts, which we started earlier today using the mobile app. Because it doesn't matter where you start or finish a doc, mobile or desktop, everything in Hospice Tools is integrated in real time on every device. So from whatever device we log in, our dashboard will show us any doc we still need to complete, which is a great reminder and helps keep our workflow and time management organized really easily. Now we simply click on the nursing visit note, and all of the information which was previously saved comes right up. Using the section drop-down menu, we're going to jump right to the medications and communication section. We have some PRN medications that were given. Some morphine was given throughout the day. It was used to treat pain and dyspnea. We can mark its effectiveness. And we have communication with our hospice physician, Dr. Jones. No concerns were reported. We instructed the caregiver, and we did some medication teaching. And you can see how robust the forms are. We can go ahead and put in our plan for the next visit. And that completes our note at this point. We'll go ahead and sign and submit the note. But the system has some required fields, so if we just try and sign and submit the note, as you see, the system flags it. So we'll put in the date. And now we can go ahead and sign and submit the note. It asks to make sure to confirm that the note is complete before we sign it. We'll click OK, and the document has been completed. If we pull up Betty's chart again, we'll see that the bubble has changed from red to green, and it's marked Submitted. And when we go back to our dashboard, the note is no longer there. We have no unfinished documents, so we've completed our clinical charting for the day. And I'm sure you'll agree, Hospice Tools eDocs makes clinical charting super simple. Now the only thing left to do in my day is complete our timesheet. So make sure to check out the Timekeeper Auto-Build video, and you'll see how with the push of a button, all of our visits and times are automatically loaded onto our timesheet. Hospice Tools, how hospice happens.